Dr. Stephanie Kamaya Reznick. I'm a board-certified internist and one of the medical directors for virtual care here at Oscar. In today's segment on diabetes, I'm going to discuss some things you can do about diabetes. First, let's start off talking about the risk factors. There are non-modifiable risk factors, meaning there's nothing you can do about it. These risk factors include things like your family history, your racial or ethnic background, your age, as well as if you've ever had gestational diabetes. Now, modifiable risk factors are things that you can control and therefore decrease your risk of developing diabetes. The biggest modifiable risk factor is your weight, with patients who are overweight or obese having a higher risk of developing diabetes. The good news is that even though it's hard to lose weight, losing weight will decrease your risk of developing diabetes. The other good news is that the healthy lifestyle changes that often contribute to weight loss, having a healthy diet and participating regularly in exercise or other physical activity, will decrease your risk of diabetes independent of weight loss. So you're kind of getting a 2-for-1 when you participate in these healthy activities. If you already have diabetes, having a healthy weight and participating in regular exercise and having good, healthy dietary habits are all important for getting your diabetes in the best control possible. If you're a diabetic, it's also important to control other factors that might increase your risk of developing diabetic complications. It's important to have a healthy blood pressure, healthy cholesterol value, and if you're a smoker, it's even more important that you quit smoking. Now, what about treatment for diabetes? Well, some patients are able to control their diabetes by using dietary changes alone. Basically, if they don't eat enough carbohydrates to get turned into excess sugar, their blood sugars won't get too high. That said, you always need at least a little bit of carbohydrate in your diet, so make sure that you speak to a healthcare professional before making any drastic changes. Many patients with diabetes ultimately end up needing medication. Some come in pill form that you can swallow, and others need to be injected. The medications work in a few different ways. Some make your cells more sensitive to the insulin. If you go back to my car analogy, where the cell is a car, insulin is a key to the gas tank, blood sugar is the gasoline, and the receptor is the opening to the gas tank. By making your cells more sensitive to the insulin, you're basically making the gas tank less tightly locked so the key works better. Other medications make your body make more insulin. Going back to the analogy, this is like having more keys or stronger keys to get the gas door to unlock. And then some people actually are injecting themselves with insulin. They're actually presenting their body with extra keys to help unlock that gas tank. As a diabetic, in addition to routine preventative care that everyone needs to undergo, there are a few additional steps you should take. It's important to get your blood work checked regularly. You need to have an annual eye exam, an annual diabetic foot exam, and you should get your urine checked at least once a year to make sure your kidneys are doing okay. With all this extra care, it's even more important to have a quarterback on your side helping you navigate throughout the system. This is where a primary care clinician becomes so important. If you're an Oscar member and you live in certain geographic areas, the virtual primary care team is here for you. We can help coordinate your care virtually and get you into the in-person care when you need it. For all Oscar members, there is always the virtual urgent care that's available 24/7 for any urgent questions or medication refills when you're unable to get a hold of your usual clinician. I hope you found this information helpful, and I'll see you next time.